Did you know that more than 90,000 people in the United States are living with end-stage renal disease, ESRD, also known as kidney failure? Once they reach this critical stage, patients have only two options: a kidney transplant or starting dialysis. Living without either of these solutions is impossible. But which of these options is really the best? And how to prevent the disease from getting worse while avoiding dialysis? Stay with us until the end to find out. But first, if you haven't already, subscribe to the channel and turn on notifications by clicking on the bell. Getting a kidney transplant is not easy. More than 100,000 Americans are on the waiting list for a transplant, and 87% of them are waiting for just one kidney. As a result, about 70% of patients with ESRD rely on dialysis to survive, a treatment that can cost up to $40,000 per year per patient. Detecting kidney failure early is critical to managing it effectively and increasing the chances of survival. The problem is that many patients with kidney failure do not notice changes in their kidneys or urine right away. It is not uncommon for there to be no noticeable difference in the volume, color, or odor of urine. Some people may notice an increased need to urinate at night, but even this is not a sure sign of kidney problems. Being aware of the symptoms of kidney failure is crucial to recognizing it in time. In this video, we will walk you through the most common signs, giving you the knowledge you need to recognize the symptoms of kidney failure and take preventive action if necessary. In addition, we will discuss some essential tests to diagnose the problem and show you what to expect during a doctor's visit. Now, let's go over what kidney failure is and what symptoms to look out for. What is renal failure, ESRD? The kidneys have a vital function in our bodies. They purify the blood by filtering out excess fluids and waste products. When the kidneys fail, as in end-stage renal disease, ESRD, the kidneys lose the ability to perform this function effectively. This stage represents the final phase of chronic kidney disease, CKD, and is commonly associated with diseases such as hypertension, cardiovascular disease, and diabetes. The main feature of ESRD is the accumulation of toxins in the blood, a condition known as uremia. Normally, these wastes should be excreted through urine, but in renal failure, they remain in the body, causing a number of serious symptoms that impact the patient's overall health. Major symptoms of kidney failure. Recognizing the symptoms of kidney failure in time can make a big difference in the management of the disease. Below, we will explore the 10 most common symptoms associated with end-stage renal disease. 1. Fatigue. A sense of continuous fatigue is one of the most common symptoms in patients with advanced renal failure. When the kidneys malfunction, toxins and wastes accumulate in the blood, causing a feeling of exhaustion. In addition, the kidneys produce less erythropoietin, a hormone that stimulates the production of red blood cells. A reduction in red blood cells causes anemia, which aggravates fatigue. For people with other medical conditions, such as diabetes, hypertension, history of heart attacks or sleep disorders, fatigue can become even more debilitating. However, one of the most effective ways to improve energy in patients with renal failure is regular physical activity. Although it may seem counterintuitive, exercise can help reduce fatigue. Some physicians prescribe erythropoiesis-stimulating agents to treat anemia. But the effectiveness of these drugs in combating fatigue is still debated. 2. Muscle cramps. Muscle cramps, especially in the legs, are common in patients with advanced CKD. These painful spasms may result from electrolyte imbalances in the blood, such as a calcium or potassium deficiency. In some cases, potassium levels may be too low, hypokalemia, a problem that can be caused by vomiting, diarrhea, or dialysis treatments. To treat muscle cramps, the doctor might add magnesium to the dialysis solution, or adjust the patient's medications to maintain proper electrolyte balance. 3. Swelling, edema. As kidney function worsens, patients may develop edema, a buildup of fluid that causes swelling, especially in the legs, ankles, and feet. This happens because the kidneys fail to remove excess sodium and fluid from the body, leading to retention of these in the tissues. Your doctor may prescribe diuretics to help eliminate excess fluid, but reducing salt consumption can also help. 4. Loss of appetite. Loss of appetite is another common sign of kidney failure. With the accumulation of toxins in the blood, patients often lose interest in food. In diabetic patients, the condition can be aggravated by gastroparesis, a slowing of gastric emptying that leads to a feeling of fullness, nausea, and abdominal pain. It is essential that patients follow the dietary directions given by their physician to prevent further worsening of the disease. 5. Constant itching. Constant itching, known as uremic pruritus, is a frequent condition among patients with ESRD, especially those on dialysis. His symptom can be so severe that it interferes with sleep. Although the exact causes of itching are unclear, it is likely to result from the accumulation of toxins in the blood. The doctor might adjust the dialysis dose or prescribe drugs such as gabapentin to relieve the symptom. 6. Shortness of breath. Feeling shortness of breath, a condition known as dyspnea, can be a frightening and dangerous symptom of kidney failure. There are several causes that can lead to this symptom. A buildup of fluid in the lungs, called pulmonary edema, is often related to an imbalance of fluids or electrolytes caused by renal failure. Anemia, common in patients with kidney disease, can also contribute to a lack of oxygen in the blood, causing dyspnea. Another reason is the presence of inflammatory waste in the blood. When the body fails to get rid of toxins properly, a condition known as protein energy malnutrition syndrome occurs. In this case, the body begins to destroy muscle tissue, including respiratory muscles, making it difficult to breathe. Treatments for this condition vary depending on the specific cause, but often include respiratory support and management of related symptoms. 7. Memory loss, confusion, or dementia. Patients with ESRD may experience cognitive deficits, which take the form of difficulty concentrating, memory loss, confusion, or even dementia. The accumulation of waste products in the blood has a negative impact on brain function and cognition. In many cases, these symptoms are aggravated by damage to blood vessels in the brain caused by reduced oxygen. Anemia or other medical conditions, such as depression and sleep disorders. To prevent and treat cognitive deficits related to renal failure, intensive blood pressure control can reduce the risk of mild cognitive decline. In addition, kidney transplant recipients often experience improved memory after surgery. 8. Urine-like breath and taste charges. A characteristic symptom of advanced renal failure is uremia, which can cause a urine-like odor in the breath, known as uremic breath. This occurs because the kidneys cannot properly eliminate toxins, and these accumulate in the blood, including ammonia, which contributes to the unpleasant odor. Some patients also report feeling a metallic or unpleasant taste in the mouth, called dysgeusia. One possible remedy for this problem is the use of mouthwashes, particularly those with bicarbonate, which can improve bad breath caused by the accumulation of dysgeusia. Regular dental checkups are also helpful to check overall oral health, which can deteriorate in patients with kidney failure. 9. Skin changes. The skin of patients with ESRD may change in appearance, becoming paler due to anemia, or darker in a process known as hyperpigmentation. Toxin accumulation, also responsible for the yellowish color of urine, can affect the skin and give it a yellowish tone. Other patients may develop very dry skin, a condition called xerosis, which occurs when the sweat and sebaceous glands function less efficiently. Keeping the skin moisturized by using creams and reducing the frequency of washing can help improve skin dryness. If significant or bothersome changes occur, a dermatologist can recommend targeted treatments to improve the appearance and comfort of the skin. 10. Lower back pain. An additional symptom of kidney failure is pain in the lower back, often located on either side of the spine where the kidneys are located. This type of pain can be caused by inflammation of the kidneys or accumulation of toxins, which causes local irritation. Although back pain can be common for many other conditions, if it is associated with other symptoms of kidney failure, it could indicate an underlying kidney problem. In such cases, it is important to contact your doctor for further examination. 1-dot test to detect kidney disease. Recognizing the symptoms of kidney failure is important. But it is also crucial to undergo specific tests to diagnose the disease before it progresses. Here are some of the most common tests that doctors use to detect kidney failure. 2. Serum creatinine levels. Creatinine is a waste product that the kidneys are supposed to filter out of the blood. A high creatinine level may indicate impaired kidney function. This test is used to calculate the glomerular filtration rate, GFR, which provides an estimate of how well the kidneys are filtering blood. A consistently low GFR suggests the presence of chronic kidney disease. 3. Blood urea nitrogen, BUN level. Another blood test that measures the amount of urea nitrogen, a waste substance that the kidneys are supposed to remove. If the levels are high, it means the kidneys are not working properly. 4. Examination of protein in the urine. Also known as proteinuria, this test checks for protein in the urine. Under normal conditions, the kidneys should only let a small amount of protein pass through the urine, so an elevated level may be a sign of kidney dysfunction. 5. Renal ultrasound. Ultrasound uses sound waves to create images of the kidneys. This exam helps detect any structural abnormalities, such as cysts or tumors, or problems in renal blood flow, all of which can contribute to chronic kidney disease. Treatments for renal failure. Management of ESRD requires a combination of treatments specific to the cause and severity of the condition. Here are the main treatment approaches. 1. Medications are key to managing the symptoms and complications of chronic renal failure. For example, antihypertensive drugs help control high blood pressure. Diuretics promote the elimination of excess fluids, and erythropoiesis-stimulating agents treat anemia. Diabetic patients may also require medications to keep blood sugar levels under control. 2. Kidney transplantation. Kidney transplantation is considered the best solution for end-stage renal failure because it replaces the damaged kidney with a healthy donated one. This eliminates the need for dialysis and offers a better outlook on life than dialysis itself. However, the procedure requires a matched donor and surgery, followed by lifelong immunosuppressive therapy to prevent organ rejection. 3. Dialysis. When renal function is severely compromised, dialysis often becomes unavoidable. Dialysis is a replacement therapy for kidney function that uses artificial methods to filter toxins from the blood. There are two main types of dialysis: hemodialysis, which uses a machine to filter blood out of the body, and peritoneal dialysis, in which a special fluid is introduced into the abdominal cavity to filter toxins through the peritoneal membrane. 4. Lifestyle changes. Adequate diet and lifestyle changes are essential for patients with ESRD. A diet low in sodium, potassium, phosphate, and protein can prevent disease progression and minimize complications. In addition, regular exercise has been shown to improve blood pressure, reduce fatigue, and improve cardiovascular health in patients with CKD. Kicking the smoking habit is another crucial change to prevent the condition from worsening. Kidney failure prevention, practical tips. Prevention of chronic renal failure and ESRD relies on three basic pillars: nutrition, control of pre-existing health conditions, and regular monitoring. Here are some practical tips to prevent worsening kidney function. 1. Follow a low-sodium and low-protein diet. A low-sodium diet can help prevent fluid accumulation and bloating, reducing the risk of hypertension. Limiting protein intake is important to reduce waste production, relieving the workload on the kidneys. 2. Regularly monitor blood pressure and blood sugar levels. Diabetes and hypertension are two major causes of CKD. Checking blood glucose and blood pressure levels regularly helps prevent kidney damage and reduces the risk of kidney failure. 3. Maintain a healthy body weight. Obesity is a risk factor for developing kidney disease as it contributes to hypertension and diabetes. Maintaining a healthy body weight through a balanced diet and regular exercise can prevent kidney failure. 4. Hydrate properly. Taking in adequate amounts of fluids every day helps maintain good kidney function. However, it is important not to overdo it, especially in the advanced stages of CKD, when too much fluid can worsen swelling and hypertension. 5. Avoid overuse of non-steroidal anti-inflammatory drugs, NSAIDs. Prolonged or excessive use of drugs such as ibuprofen and naproxen can damage the kidneys over time. If possible, consult your doctor for safer alternatives. 4. Get regular kidney checkups. Especially if you are at risk for kidney disease, for example, if you have diabetes, high blood pressure, or a family history of kidney problems, it is critical to get regular checkups. Blood and urine tests can detect abnormalities early, allowing more effective management of the disease. Conclusions. We have come to the end of this in-depth look at the signs of kidney failure and tests to avoid dialysis. Recognizing the symptoms of kidney failure early can make a big difference in quality of life and disease management. Symptoms such as fatigue, itching, swelling, shortness of breath, or cognitive changes should never be underestimated. The earlier action is taken, the greater the chances of avoiding serious complications, such as ESRD or dialysis. It is essential to stay in constant contact with your doctor, follow his or her recommendations carefully, and make lifestyle choices that help preserve kidney health. Although chronic kidney disease may seem difficult to deal with proper management and constant monitoring, many patients can live full and fulfilling lives. If you found these tips helpful, please leave a like and subscribe to the channel to stay up to date on how to protect your health. Every small gesture, such as a comment or a subscription, helps us spread vital information that you often won't hear on TV. Also, we recommend you watch the video we have embedded below, where you will find the newest advanced therapies and learn about innovation in kidney treatment.